Our question explores a patient who has previously received a course of radiotherapy and chemotherapy and then received a bone marrow transplant. What cells will the patient receive and why is this helpful? As a group, we thought of this in the dental setting. If a patient had oral cancer, they would receive both chemo and direct radiotherapy to destroy cancer cells. However, both of these therapies are not without their flaws. With regard to bone marrow stem cells, radio and chemotherapy are known to cause damage here. Chemotherapy does not cause a decrease in blood cell counts at the start of treatment, as these drugs only target rapidly dividing cells, which blood cells in circulation are not. However, new blood cells being produced in bone marrow are rapidly dividing, and these will be affected and destroyed. With radiotherapy, it is a similar story in which it targets rapidly dividing cells. High-strength radiotherapy has been shown to destroy normal cells in bone marrow. In this short video, we will explore how the patient will be affected by these treatments and which cells they will receive to help them. There are a number of cells that are affected due to chemo and radiotherapy. Of note, stem cells, which are found in the bone marrow, are affected. These cells are produced in the bone marrow and then can differentiate into more specialised cells. The three main cell types to differentiate into are erythrocytes, lymphocytes and thrombocytes. Erythrocytes, or red blood cells as more commonly known, are responsible for delivering oxygen to tissues via the cardiovascular system. They are also involved in removing carbon dioxide from the body. Chemo and radiotherapy can damage these cells while being produced in the bone marrow, and this can lead clinically to anemia. Lymphocytes, two main types, lymphoid and myeloid. Lymphoid cells are both T and B cells. T cells are part of the cell-mediated immune response and are involved in destruction of pathogens that bind to T cell receptors. B cells are cell-mediated responders that produce antibodies to help immobilise pathogens to fight infection. Myeloid cells are eosinophils, basophils, neutrophils and monocytes. Basophils are involved in inflammatory response. Eosinophils in fighting parasites. Monocytes differentiate into macrophages which perform phagocytosis, and neutrophils also do the same. Thrombocytes are platelets that allow the body to stop bleeding via blood clot formation.
Chemotherapy and radiotherapy can cause anemia, leukopenia, and thrombocytopenia. Anemia is caused by a reduction of red blood cells, leading to a reduction in hemoglobin. Leukopenia is caused by a reduction of white blood cells, and thrombocytopenia is caused by a reduction in thrombocytes. There are three kinds of bone marrow transplant: autologous, allogenic, and umbilical cord bone marrow transplants. Autologous bone marrow transplants are when stem cells are removed from the patient before treatment and replaced after treatment is complete. Allogenic bone marrow transplant are when stem cells are removed from a donor and given to the patient after treatment. Umbilical cord bone marrow transplant is when stem cells are taken from the umbilical cord and stored until needed for transplant in future. The bone marrow transplant provides new hematopoietic stem cells. This allows a restoration of the patient's own bone marrow, which was damaged from the chemo or radiotherapy treatment, and it also allows a replacement of bone marrow damaged by disease.